Y'all, menopause sucks. I know that I probably don't have to tell you this, but menopause can really wreck your sleep. So I want to share a little bit about why that happens and maybe a little bit about what we can do about it. So in my last video, I talked about how reproductive hormones like estrogen and progesterone play a role in sleep, a really important role in sleep for women. Well, when we hit menopause, the changes in these hormones can mean a lot of disruptions for sleep. So let's take estrogen, for example. Estrogen helps to regulate sleep by influencing serotonin and other neurotransmitters. These neurotransmitters are important for mood and our ability to sustain sleep. They also are really important for maintaining body temperature as well. So as estrogen levels start to decline during menopause, women can have hot flashes, night sweats, sudden surges of heat that can wake you up and cause really fragmented sleep. So along with that come the mood changes associated with serotonin. So lower serotonin contribute to mood swings, anxiety, and overall just making it really hard to wind down for sleep at night. Estrogen is really important with helping us to maintain deeper sleep, more restorative sleep. And so lower levels of it lead to lighter, more fragmented sleep, which can be really bothersome. Progesterone is another hormone that's impacted. Progesterone generally has a calming sedative effect in sleep, and it also helps us to maintain muscle tone in our upper airway. So without progesterone, we are more likely to experience what we call obstructive sleep apnea. So that means that we are more likely to experience breathing interruptions in sleep, and those breathing interruptions cause us to wake up more so that we can catch our breath and therefore fragment sleeps even further. So without these hormones, our sleep can be a lot more disrupted and fragmented. And on top of that, we naturally are more inclined to mood problems. And then finally, if we're not getting enough sleep, that gives us more issues with mood. And then there's another hormone called cortisol. Cortisol follows a natural diurnal pattern, which means that it has a 24-hour peak and then dip. It peaks in the morning and then it dips at night. But all the sleep disruption of menopause can make it harder for cortisol to be regulated in the body, and it can make it harder to sleep. And generally, we can feel more stressed out. These hormonal fluctuations during menopause make the brain and body a lot more susceptible to stress and a lot more susceptible to sleep problems, on top of the natural biological things that are happening, like disrupted sleep because of hot flashes. So the brain essentially gets stuck in this really heightened state of alertness, and it makes it really difficult to unwind and stay asleep. The good news, though, is that managing hormones with hormone replacement therapy can be helpful for sleep. Additionally, cognitive behavioral therapy for insomnia, the type of treatment that I specialize in, also is really effective for addressing menopausal insomnia. So if you have concerns or if you have questions, feel free to comment down below. You can also schedule a 15-minute consultation with me if you have some questions or are interested in getting started in some treatment. All right, that's it for now. Take care.